Hello there, you're welcome to another exciting episode of the Maternity Show on African Renaissance TV with me, Sona Dabu. I am super excited to bring you this episode because we will be talking about everything that happens in the labor room. Of course, we are at FajiKunda and we'll be having this discussion with the OIC of FajiKunda, Ramatulai Kamara. Join me as I take you through everything that you need to know about what goes on in the labor room. Let's do this. Like I said, we're here with the OIC of FajiKunda Major Health Center. And Ramatulai, thank you so much for honoring our invitation.
Thank you.
So I told my people that this is going to be so much fun because it's something that I was so much looking forward to. Like in the labor room, we know women go through a lot inside the labor room, but we can never tell exactly what pain they go through. So as a curious person, and I also know my viewers are also kind of curious to really understand what goes inside this labor room, can you take us through first the stages of labor?
Thank you very much for coming to FajiKunda Major Health Center. The stages of labor, we have about up to 3 or 4 stages of labor, depending on how you want to define it. The first stages is where the woman, there is a lot of anxiety. It's where the woman, there is a strong contraction, painful contractions, and then you have what they call fully dilatation of the cervical os. That is the opening of the womb, or people say in local one, it's a placid you kind of or something like that. So this is it. And during this stage, the woman needs a lot of support, especially for a primate mother. That is the first timers who came in. This is the first experience of having a child. There are a lot of anxiety. There are a lot of fear in them because they don't know what is going to be the outcome like. So what we do in the labor is like we try to give them psychological therapy or support in the first stage. And when you go to the second stage, is the short stage, but it's a very crucial stage again, because that is where the birth of the baby. That is where the joy comes in the both parents. The happiness comes, the smile comes. Then the baby is being born, but yet still not being separated from the mother, because there is a connection. It's called the umbilical cord that is connecting the baby and the mother together. So that is where the second stage ends.
Wow.
And when you're talking about the third stage, what happened is when you cut that cord, you are going to separate the mother from the child, from the mother and the baby. So at the end of the day, the third and the fourth stage started from where you expel all the membranes, the placenta is being delivered, blood have been controlled, uterus have been contracted. Some people said fourth stage. The fourth stage is at least you have 4 hours postpartum in observing that woman for any possible sign of bleeding. Sure.
Nice. So it is already getting emotional for me. Time to time, probably we'll just mix in our love and see how our viewers would kind of tap into really understand what we're trying to say. So what I really want to know now is from the different stages now, what pain do women really go through?
My dear, theory tells us that the pain of labor is as if you hold 12 bones, hard bones, femoral bones. You want to break it together. No one can express the pain you undergo through. The pain is so much that I always said it's only God who himself can explain the amount of pain that the woman undergoes. The pain is unexplainable. So much painful. Every woman will be able to explain just a bit of what they feel, but they cannot actually tell you the pain they were feeling throughout those stages.
Nice. So in FajiKunda, we know you receive lots of pregnant women, so how do you help them manage this pain when they come?
Okay, we have what they call pain techniques, okay? Normally, if you go around the labor ward, you see each room have a television. We have something that we need to know what distracts you. We need to get something to entertain you, at least to give you a bit of distraction out, so that you, even if you're feeling the pain, but your mind is being distracted with something going around you. We'll ask you, we'll try to play videos of how to push your baby, how you manage the pain. Sometimes we do what they call you train them at the back. That's why we encourage male involvement in marriage. Okay, we advocate for the men to come along when there is pain. Sometimes the nurses, they do it. They massage your back. They try to help you massage the back, and then just walk around with you just to ease the pain. Some will request for one bath, then we put on the heater, and they will take a warm bath. Whatever you want, if we can afford it at a time, we try to provide it for you.
That's nice. I think you're really doing an incredible job down there. So also, I really wanted to understand, is it on a woman to kind of finalize what kind of delivery they would want? Like the normal delivery, I wouldn't call the other one an abnormal delivery, but when do we have the different deliveries come in for a woman?
Yeah, when it comes to labor, that's why I said pregnancy should be planned, okay? It's not an individual thing. The couple should sit and they plan. How do I want to have my child? Some people will say, I want to go through a vaginal delivery, okay? Some people want to say, no, I don't want to feel the pain of labor. I want to go through a C-section. The option is yes. But sometimes, again, things occur along the line. You might opt in to go in for a vaginal delivery, and along the line, you have what we call a CPD. You understand me? Where is it like the presenting part, the baby head is unable to pass the pelvic outlet. So maybe initially you want to do a vaginal delivery. Now they have to give you an alternative for you to save your baby and your life. You need to go for a C-section.
So if the C-section comes into play, does that mean you're not having another baby through vaginal delivery again?
Of course, you have a baby through vaginal delivery. So it depends. So you have some women that they are called the short status women. Some women have what they call the atropoid pelvic. You know, a woman have a gynecol pelvic. Obviously, that is a very acceptable and conducive pelvic for vaginal delivery. So obviously, if at all the cause of the CS is through CPD, and that is your first baby, there is a high possible chance that the second baby will go through a cesarean section. Depends on your anatomical makeup. Yeah.
Nice. So I wanted to bring this first, but because of my curious mind, I went through another way. I wanted to understand as a woman, like if I walk into FajiKunda Health Center right now, what should I do, to be able to access the labor ward? Let's say I've been coming here for prenatal care services, or I've not been coming here for prenatal care services. How do you take me through to the labor?
Okay, that is very important. For us, as we said, whether you booked or you come for any antenatal services in every facility, it's your choice, it's your right to choose where you want to deliver your baby. It's your choice. Coming to FajiKunda, actually, whether you are attending your prenatal service here or not, we accept you as you come in. Coming into the labor room, the only thing that we might have challenged with you is like, we had what we call a back plan arrangement. If you book with us, and I'm very sure other facilities do the same thing. Sure. So we ask them to prepare their delivery pack. Sometimes, if that's the challenge we have, if you don't book in FajiKunda, some don't come with any delivery pack, or some only come with just few unkept clothes. So you see, and we're trying to know about sepsis for both the mother and the child. Yeah. Do you want a sterility delivery? So at the end of the day, what we do, we have to welcome you in. This is where you choose to deliver, and we take you through the stages of labor until you have your baby safe and sound.
So I would want us to do that for the world of, so that we kind of get their attention to really understand, what they need to do as a woman once you come to FajiKunda.
Okay, come, jigen bubir mom. Nga boka fi nos boko lo fi nos so ñoy pour am sa dom kay ding na ci dé and na ci dé welcome pour nga dugg ci li ñu gëna sonal moy comme su fekké ni boko lo fi nos man yaakar né l'hôpital yépp dañ ko dé wax dañu am ño xamné bagage yo xamné dañ ko wara tek apart so wara am dom bu nga isi walé pour at least nga gis né bobu bagage yu set yo xamné duñ isi ay tolof ci balé bi wala ci yaay bi comme ay infection yo xamné le mot de sepsis infection ba xamné nga gis yeneen jigéen ci am doom ñu mu jeex am yaram bu tàng bu xamné do di yu wala nga wosil sa doom bi xalé di do di am ay yaram bu tàng wala do di crise loolu yépp dañ di mëna dañ di bëgg arrêté yoyu non mëna comme la nga isi yo xamné ñoo gëna set waye ben tay su fekkee ne isi loolu loolu tamit ñu am nañ yére boo xam ne soo fi dugga boobu lañ na dee simé ñu solal comme theatre gown boobu mooy yére boo xam ne hôpital bi moo ko moom doo ko yóbbu soo ñëwee li yére bi nga isi lañ na dee simé boobu ngay sol ñu sol sa scrub bi si sa tànk bi ñu dugga la si biir bi nga am sa doom si jaama sala si ñu mun a oo seen mbokk ay ñëw gars yi ñu isi leen sa yére loolu lañ di defee waaw.
Thank you so much. So for a woman that is expecting twins, for instance, what should the person be emotionally prepared for?
When you call twins, sometimes there are a lot of excitement in some of them there's sort of fear that is been attached to it. I always said a labor is unpredictable, but whatever we all expect a live babies and a healthy mother and a healthy baby to be delivered at the end of the day. So normally what they expect, there are anxiety to be carrying with you. When after this car, they tell you have 2 kids coming up. So the worry is like, how am I going to go? Because it's like 2 different processes.
Sure.
2 different processes. You deliver the first one, you have to give the second one chance for it to go through all those stages. Sometimes it's faster. Sometimes it can go up to 2 or 3 hours. Sometimes it can even take up to 45 minutes. So it depends the way the contractions come and also the presenting part, how the baby is coming. Yeah.
Nice. I really want us to continue at this point, but we will just take a short break and then we will be back. Then we will talk about how nurses would manage their own stress, because I think this is also stressful for them at some point. Yeah, so we'll just go on a quick break and we'll be back. Welcome back from that very short break. If you're joining us now, this is the Maternity Show on African Renaissance TV with me, Sonia Dabo, and today we are in the labor room for you with Ramatulai Kamara from FajiKunda. So before we go on that break, we were looking at some pain management issues for women. Now, I also want to understand the stress that can come from the aspect of the midwives, because seeing a lady go through that much pain, I think they also go through pain. How do they manage their own part?
My dear, in anything that you are doing, you have to take care of yourself first and then the others. Sure. As a woman, sometimes you don't have to be sympathetic. You have to have an empathy as a healthcare provider. Because when you are sympathetic, if you don't take care, you even manifest the pain than the patient that you are able to take care of. So, and normally what we do, we train ourselves how to manage pain emotionally and psychologically, how to control.
That's nice. I think taking care of yourselves as healthcare providers will go a long way in helping you take care of the women that also come to you for services. Now, with all this thing, like the joy of motherhood and all that, what could actually go wrong in the labor room for women, for you?
Sometimes a lot of things go on in the labor room. Okay. Whenever the baby, there is a saying that the birth of the baby is the joy of the mother and is the worrisome of the healthcare professional, being a midwife or anybody conducting the delivery. Why? Because the 3rd and the 4th stage, that stage is the most crucial stage in the life of the woman, because that's where you have a lot of complications arises. Complications such like where the bleeding cannot be stopped, excessive bleeding from the mother, and you are trying to control that bleeding, and if care is not taken, it can result to what we call DIC, or we can even lose that patient. So it's a very crucial stage. So the 3rd and 4th stage is a very, very important stage for any healthcare provider who is participating or assisting in conducting the delivery for a woman. You need all attention to be on that.
That's where the hemorrhage and all.
That is where the bleeding occurs. Sometimes you can have an APH, an abrupture, before even coming to the facility. Sometimes even during the process of delivery, you can have an abrupture. Because normally, these mothers, I don't know, I know our grandmothers, their time and now, they're still trying to use traditional herbs, okay, to give in terms of hasting the labor process. And in that process, you do a lot of wearing and tearing as the baby forces itself to come out.
Now I realize some women use taba to do that.
They use taba. We have a lot of things even around. Some they use jamba kasala. They use a lot of things. Obinyambi, parajam. It's just too much mixing all these toxic drugs together, and then in the that when you come to the facility, you take it, you just deliver quickly, and then you go, and your baby will be out with a lot of complications coming out, and then you keep us. You are going to put the mother life at risk, where the woman will bleed and bleed and bleed and bleed. If the care is not taken, even bleed to death.
I would love to have that in Wolof, for instance.
Comme nous avons moi cibir lebo moi dañ di am ay torof yu bari ñu fa dé nekk. Gis nga am doom du fofu la wasin bi mu dem. Xale bi su génné moy xalaté nosi wala ala si docteur si wala ala képp ko xam ne mun la dimbale si pour am doom parce que lu ko waral mooy nacca deret bi jigéen yu bari soo gisee di ngay ñàkk seen bakkan mi si mat loolu moo leen di yóbbu deret dañ di nacca beex gars yi develop condition boo xam ne mooy DIC mooy condition boo xam ne deret bi di soote loo mënta dox su amuloo fresh deret pour may kooku noonu nag boobu mooy dem mooy jigéen bi dafay ñàkk bakkanam bi lu bari def ko dee waral suñu yaay ma leen ñaan liggéey bi ngeen nekk di def waxuma baaxut de waaye li ngeen ko dee def moo amut yoon parce que garab yi nekk di ji xob yi baax na baaxut xob yi dafa fooray bi am nga xale bi di ñëw boo du ko gis ci biir la nekk doo xam naka la xale bi di ñëwee yeneen xale di ñëw wax boppa yeneen xale bi di ànd ak tànk yeneen xale bi xam ne dañuy tëdd si seen wet soo ko forcé xale ba am ne mu tëddal wet pour mu génn naka la mën a génnee du génn yaa ngi ko forcé ma ne xale bi dafa war a génne by force xale bi du mën a génn métit bi di yokka xale bi di jigéen bi di am métit bi bala nga àgg si hôpital bi fekkee ne lu bari yàq na ci biir jurikaay jigéen bi di nit nacca deret fekkee ne xale bi génn wala mu am doom mu jot di nacca deret bu xam ne kenn du xam na naay def di yàq lu bari et na nga gis seen place jurukaay di xar ci biir so loolu yëpp maa lay ñaan boobu mooy suñ métit boo xam ne si biir FajiKunda saa yu nekk dañ de seerawante si biir wor bi sax keneen ki su xamee dañ ko dee dugal ci seen biir baag bi di ko nu wax wala mairie di dugal ci doo di jox jigéen ñi di naan mu ne naanal lii dafa gaawaloon mattu bi maa lay ñaan please dañ bàyyi loolu noonu ñun su gisee ngeen ñëw fii gannaaw yàlla da ngeen tekk yaakaar si ñun suñ gisee mat bi nekku di dem nu mu war a demee ñun am nañ garab boo xam ne dañ leen war a jox pour ñu jàppale ngeen am seen doom bi si jàmm salaam.
Thank you. I was even coming to that, like the kind of challenges you face here. But I think that's quite important for our mothers out there to really understand that in as much as they want to help the woman, they should also put into consideration how harmful these herbs can be to the woman that they are giving it to. So also, before we wrap up this discussion, I know we have lots of things that we want to talk about, but the time might not permit us. What do you think would be the responsibility of the husband of these women that come here, and of course the society in general, and probably even the government, in terms of things that happen in the labor room? How do we make things better for women?
Yeah, I think this male involvement in reproductive and child care is very important. Why we want to bring men on board so that they will prepare their mind psychologically, they will plan their pregnancy properly, because when you call a pregnancy, it's a whole planning process. It's a yearly process. You have to think about the economical status of you as a man and the mother and the unborn child that is coming. You have to think about the physical part of it, and also you have to think about the medical side of it. Especially when the woman needs a blood, you should be already prepared. I'm there to give out. I'm here to donate a blood, at least to save the life of my wife. When it comes to the government, is what we need. The government need to do is to strengthening the health sectors, the health services, the facility, infrastructure, right, which is going on, but to be well equipped with emergency materials, because when they occur, these are life-saving materials that at least will count a lot, okay? So when I mean the government, we are all the government,
sure.
Okay? And when people have very misconceptions about the government, they think about the president and say, oh, we are all government.
Sure.
It's what we can do to help, to avert, at least to reverse or to minimize maternal death in the country. And the society, please, let's try as much as we can to seek out health-seeking behavior. Let us just don't assume that because the then life of our forefathers, this is how they were doing things, and the same thing will work for us. So I think society have a lot of role to play.
Sure.
And us as a healthcare provider, we need to strengthen more on sensitization out here.
Sure.
They need to go for community outreach, help to express what is our problem that we are facing. And I know education is power. If the society is well educated, I know they will try to work over it.
Thank you so much. Those are really wise words, and then I was carried away. So viewers, this is all that we have for you on this episode of the Maternity Show. And before we let you go, Anjana, probably your words of wisdom with the viewership.
What I want to say to all of everybody, jigéeni dañ des wax mat ku biir kontaan doom bégg rek lay def si xol si biir sëy bi xale bi kenn amul lu la war a doon ëllëg so pour ñu mën a jàppale xale bi time bu mu nekk ci biir yaayam bee mu jur bee mu door di mag is a process xale bi foog ñu ko war a jàppale bee mu mag faat na nekk dara si society ëllëg come we need to work hand in gloves to make sure that we help our mothers. Please, I'm begging men, come on board. Try to help the mothers, try to help the woman, be their guardians. Don't take labor to be only woman thing.
Sure.
Take it as a partner. It's us. It's two comes together to make a child. A woman can never have a child on her own without her husband. That is not possible. There must be something implanted in that woman for that thing to grow and become a baby. And that baby need to be nurtured, careful, since in utero till the child is born, and to the child go to the developmental stage, and that child grows up to become a productive somebody in society. So that's all I want to say. Let's just work hand in glove, help our mothers, and then help our unborn child.
Thank you so much. Thank you for honoring us. And she did say it's not a one-man show. So therefore, we are counting on all of you to join us to make sure we have positive pregnancies for every woman that goes through pregnancy. On that note, we are going to draw the curtains here for you, viewers, and then we thank you all for joining us. Just to remind you that this show is still open for partnerships and sponsors. Please, this is Sona Dabo on African Renaissance TV, and this is the Maternity Show. Bye from us.